name is Kevin Lund. I'm a certified specialist in oral maxillofacial surgery. I practice in Edmonton, Alberta, Canada. I teach at the Faculty of Medicine and Dentistry at the University of Alberta. How adaptable that membrane is to the augmentation. I want it to lay flat. I don't want to have problems with coverage. I like to have a product that's easy to work with. I want a product that has value. Cost, obviously, that's a big issue. And, and supply. Is it always available? I use it every day, and that is no lie. Every single day that I do surgery, I'm using the membrane. I do augmentations on a daily basis. The two most common clinical situations are for any type of onlay bone grafting, vertical bone grafting, for maxillary mandibular augmentation. The most I like about it, the way it handles. It's very easy to handle, and I also like it because I don't have to worry about having the correct side up. You can use it either way, and that's, I think, is important because when you're in busy practice and you're trying to get your procedures completed, I don't want to be dealing with membranes that I put upside down. Any type of GBR situation. I think once they have an opportunity to try the product and see its handling capacities and see how well it adapts to the graft site, I think they'll be convinced.